Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic for chronic disease reversal in Atlanta, Georgia. And today we're joined by Miss Michelle Villarreal. She came from Laredo, Texas. Is that right?
That's correct, yes.
Yep. Back in May of 2018. It's now November, which is approximately 5 or 6 months since we first saw you. Michelle is here for her re-exam. We're doing a reassessment. We've been working with her long distance over phone and emails. We do with most of our long distance patients. And Michelle is doing quite well. She's going to share her experience and her story with us today. So Michelle, tell us what originally brought you to the clinic. What kind of problem were you having at the time?
Well, I had a lot of pain. I had a lot of inflammation. I've had this for about 6 years now.
Did you have a medical diagnosis?
Yes, rheumatoid arthritis. Yes, I do. And I get emails from Clint Pattison, and I saw you all on a podcast for Clint Pattison. And I saw that Dr. Goldberg had reversed his rheumatoid arthritis, his autoimmunity, and autoimmune disease, I'm sorry. And I was really interested because I mean, as a dietitian, I followed a certain way of eating, and I did really well for myself for, a few years. But then I got to a level of pain that I couldn't tolerate anymore, and I ended up being on prednisone. So I didn't want to take any kind of medications because I've seen the side effects, and I thought it was going to hurt me more than help me.
Right.
So that's why I came with you all to see how you could help me.
Okay, well, we're glad that you found out about us. We did do an interview with Clint, who has a program for patients with rheumatoid arthritis. Helped a lot of people, and Clint's a bright guy. And some of his clients have come to see us who were in need of some more individualized type care, where we really try to hone in on the specific factors that were going on with them and create an individualized program specific to their needs, which is needed in some cases. You were diagnosed with rheumatoid arthritis by a medical rheumatologist.
Yes.
You were given prednisone,
Yes.
which is a very common medication that's prescribed. Prednisone is highly problematic, however. Dr. Goldberg often refers to that drug as an enjoy now and pay later kind of approach, because while it may temporarily suppress symptoms, the patient's going to pay for it later, just by virtue of the side effects, which can involve osteoporosis, thinning of the skin, cataracts, diabetes, increased risk of infection, cancer, tuberculosis, and the list just goes on. There's a long list of problems.
Yes.
And patients simply will not get well taking prednisone. There's actually a very good article on our website called Problems with Prednisone, which discusses that all that in detail.
No, but I was prescribed prednisone as like the first step, and then they were going to put me on methotrexate, so I didn't want to
that's right.
go that route.
It's a very predictable course where they start with steroids, sometimes some other drugs too, but the drugs get more and more toxic over time. You get methotrexate, and oftentimes the biologics, things like Remicade, Humira, and Enbrel, which come with another set of side effects. We've seen patients develop cancer from those drugs. So the medical approach is not one that builds health. It may suppress symptoms, but the patient invariably gets worse and worse over time and can get develop some new health problems that are even much more severe than the ones that they have.
Yes, exactly.
So our approach is much different. We refer to what we do here as bio-hygiene and recreation, where we focus on saying, well, what caused this person to develop this problem in the first place? What were the factors involved? Let's get to the root issues. Let's address those factors directly. And rather than treat symptoms, let's build health and recreate this person's body. If people get healthy, then these types of problems just go away on their own. Right, so we worked with Michelle and developed an individualized program for her, did some testing and honed in on some specifics. And so it's been about 6 months. You and I have been working on email for a while. And tell us what the difference has been now. What has changed?
It's pretty much night and day. I mean, my mobility is back. When I first came in, I was on prednisone, and I had to take it because just the travel alone was very taxing on my body, and I was very fatigued. So the movement was very difficult for me. I had a lot of pain. I couldn't sleep. And so the time that I came in, and I mean, I even to the point where when we left here on the flight, my feet were so swollen that I had to buy a pair of flip-flops just to change out when we had our layover in Dallas. But I've noticed a big difference in pain improvement. I mean, of course, there are some days where I do feel, depending on the weather or whatever, but it is 100% improved. I'm not taking the prednisone.
So you're off prednisone entirely.
Yeah, I'm not taking any.
And that by itself is a huge accomplishment.
Yes, yeah.
Absolutely.
So,
Right. So your mobility's better. We're going to list some things that are better here. Your mobility's better. Your energy's better. The swelling in your hands and feet is much less. We have less joint pain. So Michelle, in what's a relatively short period of time, considering I think you were first diagnosed in 2013.
Yes.
About 5 or 6 years ago. So 5 or 6 year history, and these problems were in development before that.
Yes.
And to be doing this well 6 months later is absolutely fantastic.
Yes, no, it's a huge improvement.
Yeah.
Thank you all for helping me.
Oh, you're welcome. And Michelle has worked very hard with us. You know, no patient at this office gets well without putting forth effort.
No.
That's for sure.
Yeah.
Right? So patients that work hard with us and persevere and are patient and persistent and allow time for their body to start to recover are usually very successful, as we can see in Michelle's case and many of the other examples on our website as well. So Michelle, we're thrilled. We still have work to do. We're going to do some retesting today to see what's changed and what areas we still need to work on. But we're thrilled with the changes, and Michelle has a great opportunity to get well and stay well for the future.
That's the goal.
All right. Thank you so much for sharing today.
Thank you, Dr. Jenner.